Hi, and welcome to Chapter 8. This week we're going to be talking about privacy, security, and fraud. So, what is privacy? Privacy is freedom from unauthorized intrusion. Right to privacy is derived from amendments to the U.S. Constitution, including the 1st, 3rd, 4th, 5th, 9th, and 14th Amendments. So first, let's talk about federal privacy laws. Information collected and stored about individuals should be limited to what is necessary to carry out the functions of the business or government agency collecting the information. Once it is collected, access to personal information should be limited to those employees who must use the information when performing their jobs. Personal information cannot be released outside the organization without permission of the subject. And the person should know that the information is being collected and should have the opportunity to check the information for accuracy to make sure it's correct. Confidentiality is the act of holding information in confidence, not to be released to unauthorized individuals. Super important in dentistry especially. Privileged communication is information held confidential within a protected relationship, such as between provider and patient. Maintaining confidentiality. Make sure that we have an obtained signed consent form. Avoid judgments about patients' morals. Financial information is also confidential. While on the phone, do not use a patient's name if others are around you. Use caution when leaving messages on someone's voicemail. And keep patient information out of sight from other patients or visitors. Lastly, make only legal exceptions to disclosure. So only if it is requested from a subpoena or a lawyer, things like that. In those cases, it's usually okay to submit documents without the patient's approval. There are certain situations when confidentiality can be waived. So these are situations where a third party may request a medical examination and that party pays the physician's fee, or when a lawsuit and patient records are subpoenaed, when a waiver has been signed by the patient agreeing to release the information as well. Next, we'll discuss a little bit about HIPAA standards. So there's 4 main standards here that we're going to focus on. Standard 1, transactions and code sets. Standard 2, privacy rule. Standard 3, security rule. And Standard 4, national identifier standards. We're going to talk a little bit more, though, in depth about standard number 2, the privacy rule. So the HIPAA Standard 2 privacy rule deals a lot with protected health information, which is otherwise known as PHI. PHI includes past, present, or future physical or mental health conditions of a patient, documentation of the provision of healthcare, past, present, or future payment for the provision of healthcare. This PHI must be protected against all unauthorized disclosure, whether it is spoken, written, or even in electronic form. So all of this information of patients is protected. Covered entities and business associates. So covered entities, also known as CEs, are healthcare providers who conduct administrative and financial transactions in electronic form. This includes all employees, volunteers, trainees, and any other who are under the control of the entity. And then business associates, or BAs, are individuals and or organizations that provide certain functions, activities, or services on behalf of covered entities that involve access to or use of disclosure of that patient's protected health information. Next, we'll talk about HIPAA permissions. So when using or disclosing a patient's private health information, it must fall within one of the 6 HIPAA-defined permissions. Number 1 is disclosure to patients who ask to see their own medical records. Number 2, use or disclosure for treatment, payment, or healthcare operations. This is typically used by the facility for coordinating care, prescribing medications, ordering labs, things like that. Number 3 is use and disclosure with opportunity to agree or object, like informal permission that clearly allows individuals to agree or object to the release of their information. Number 4 is incidental uses and disclosures of PHI. Some examples that the book has are such as a nursing care center, where staff members can talk about the patient's care if they take reasonable precautions to prevent unauthorized individuals, such as visitors in the area, from overhearing. Another example is healthcare practitioners can discuss lab results with patients and among themselves in a joint treatment area if they take reasonable precautions to ensure that others cannot overhear. So the key sign is that other people cannot overhear this information. Next, public interest and benefit activities. So some of the examples that the book provides are for victims of abuse or neglect, for law enforcement purposes as well, for research, in the event of serious threat to health or safety, and in claims for workers' compensation. And then number 6 is for limited data sets, which is used for research, healthcare operations, or public health purposes. So HIPAA does have a security rule for maintaining the security of a patient's electronic health records. This includes the transmission of these records, the storage of them as well, and there are substantial fines if someone is found to be in non-compliance of these rules. And then there is the HITECH rule, which is the Health Information Technology for Economic and Clinical Health Act, which has since strengthened privacy and security protections for patients' private health information. Because everything is digital now, there is a lot of easy ways to hack information online. So these rules just allow for better security to keep all of our patients' information safe. So security rule requirements. Covered entities must implement safeguards to protect a patient's private health information. We need to ensure the confidentiality, integrity, and availability of all PHI that we create, receive, maintain, or transmit. We need to identify and protect against reasonably anticipated threats to the security or integrity of that information. And we need to protect against reasonably anticipated impermissible uses of disclosures as well. Lastly, ensure compliance by everyone that works in the office as well. It's not just up to the front desk to keep this information safe, it's up to the entire office. So what happens if there's a breach with a patient's private health information? A breach is an impermissible use or disclosure of a patient's record by a covered entity. Any breach of more than 500 records for patients requires notification to the media, in addition to all the patients affected by the breach. This can become a big issue. Since 2009, the Office of Civil Rights has maintained a database of PHI breaches. So they keep track of when these breaches occur and who they occur by, and patients have the right to look up that information. Business associates must also follow notification guidelines as well, and there are fines for breaches that can be pretty substantial. Fraud and abuse in healthcare. So Medical Fraud Strike Force combines federal, state, and local law enforcement to find and prosecute fraud and abuse. Fraudulent spending is not always separated from total healthcare dollars. Fraud continues to increase, and fraud is often undetected as well, which makes it difficult to track down who did it. So there is also a Federal False Claims Act. This allows individuals to bring civil actions on behalf of the federal government for false claims. Qui tam is a Latin term that is commonly applied. This is a whistleblower concept in the United States legal system where it allows individuals who blow the whistle in fraud against the government to receive all or part of the financial recovery received by the government. In a qui tam action, a relator brings an action against a person or company on the government's behalf, and then the government, not the relator, is considered the plaintiff. Once the court proceedings are decided, whistleblowers may share in any court-awarded damages. Next, we'll discuss the federal anti-kickback law. Knowingly and willfully receiving or paying anything of value to influence referral of federal healthcare program business is against the law. Possible punishments include fines, prison term sentences, and even loss of participation in federal programs. The Stark Law says that physicians or members of their immediate family with a financial interest are restricted from referring patients to entities owned by that physician. This applies to both Medicaid and Medicare programs. And last, we have the Criminal Healthcare Fraud Statute. This prohibits knowingly or willingly executing a scheme or attempting to execute a scheme with the intent to defraud any healthcare program or to obtain by false pretenses, representations, or promises any money or property under the control of any healthcare benefit program.